Let us discuss about carcinoma stomach. First, we will discuss about risk factors of carcinoma of stomach. Risk factors. Risk factors will divide into nutritional risk factors, social risk factors, environmental risk factors, medical risk factors, occupational risk factors, and some other risk factors. Okay. First, we'll see the nutritional risk factors. Nutritional risk factors: low fat and low protein intake. Low fat and low protein intake. Second one is high complex carbohydrate intake. High complex carbohydrate intake. Increased intake of nitrates. Increased intake of nitrates. Salted meat. These are the nutritional risk factors. The first one is low fat or low protein intake, high complex carbohydrate intake, increased intake of nitrates, and salted meat. These are nutritional risk factors. Then moving to social risk factors. Social risk factor is low socioeconomic state. Next, environmental risk factors. The environmental risk factors are smoking, lack of refrigeration, use of well water. These are environmental risk factors. Then moving to medical risk factors. The medical risk factors are history of gastrectomy, history of pylori infection, Epstein-Barr virus infection, adenomatous polyp, chronic atrophic gastritis, Menetrier disease, These are the medical risk factors, and the occupational risk factors include these are rubber and coal workers. Other risk factors include male gender, and HNPCC. This is hereditary non-polyposis colon cancer. Hereditary non-polyposis colon cancer, and Lee-Fraumeni syndrome. Flamini syndrome, pernicious anemia, pernicious anemia. One thing we have to remember here is alcohol is not a risk factor. Alcohol is not a risk factor. Alcohol is not a risk factor. Okay, this you must remember. Most of the people think that even alcohol also a risk factor, but that's not true. Alcohol not at all a risk factor for stomach cancer. Let's see the protective factors. These so far we discussed about the factors that increase the risk. So let's see the factors that decrease the risk of stomach cancer. Protective factors. We can remember this by mnemonic SIJAC. Okay, S means selenium, I means iron, Z means zinc, A means aspirin and vitamin A. Aspirin and vitamin A. C for calcium and vitamin C. Calcium and vitamin C. These are protective factors